Hi, I'm Igor and today we will go talk about polyarteritis nodosa. It's systemic vasculitis of medium-sized vessel and small muscular arteries leading to tissue ischemia. Most commonly involves the skin, peripheral nerves, muscle, joints, gastrointestinal tract, and kidneys. Epidemiology is peak incidence of this disease between 45 to 65 years of age, and sex more in men compared to women. Etiology in most cases are diabetic, maybe viral infection, hepatitis B, less frequently other virus, hepatitis C, HIV, cytomegalovirus. Clinical features include nonspecific symptoms such as fever, weight loss, malaise, muscle and joint pain. Organ involvement include renal involvement, its symptoms hypertension and renal impairment, increased creatinine ratio. Coronary artery involvement is increased risk of myocardial infarction. Skin involvement is rash, ulceration, nodules. Neurological involvement is polyneuropathy, mononeuritis multiplex, and stroke. GI involvement: abdominal pain, melena, nausea, vomiting, usually spares the lung. In polyarteritis nodosa and pneumonic, for this disease is PAN. The pulmonary artery is not involved. PAN, panmural inflammation of the arterial wall is present, and PAN may be associated with hepatitis B. PAN should be considered in adults less than 65 years of age, presented with stroke or myocardial infarction. Diagnosis: general principle for this disease: it can involve many organs. No specific is pathognomonic for polyarteritis nodosa. Biopsy and visceral angiography is required to confirm the diagnosis. Laboratory studies is inflammatory markers, increased erythrocyte sedimentation rate, increased C-reactive peptide, complete blood count. We can see anemia of chronic disease, leukocytosis, thrombocytosis. Additional studies is basal metabolic panel, increased creatinine is renal involvement, and serology: hepatitis B, hepatitis C, negative antineutrophilic cytoplasmic antibody, and cryoglobulins. Urinalysis is mild to moderate proteinuria and/or hematuria if there is renal involvement. Visceral angiography of affected organs. Indication for this procedure considered if biopsy is not possible. Findings most commonly seen in the renal, mesenteric, hepatic artery branches. Pulmonary artery are usually not affected. Numerous macroaneurysm is between 1 to 5 mm in diameter. Stenosis of small muscular arteries and medium-sized vessels. CTA or MRI indication is assessment of disease extension, progression, and response to treatment. Findings: visceral hemorrhage or necrosis, large aneurysm, stenosis, and/or occlusion of the main renal artery and its branches. Biopsy of affected tissue. Indication for this procedure if patient with accessible affected tissue, for example, muscle, skin, sural nerve. Findings is transmural inflammation with leukocytic infiltration and fibrinoid necrosis. Inflammatory lesion in various stages of development and progression. Treatment: general principle for treatment of this disease is immunosuppressant. For example, glucocorticoids plus cyclophosphamide are indicated for all patients and to achieve remission. Antiviral therapy is indicated for patient HBV-associated polyarteritis nodosa. Pharmacotherapy, initial therapy, start remission induction therapy for patients with active disease. Thank you. Subscribe to the channel.